So in order to decide if you should take Viagra or Cialis, you really have to think about it as it pertains to the sexual goals that you have for yourself. So choosing between Viagra and Cialis for erectile dysfunction may seem on the surface that you're choosing from two medications that are essentially the same, but Viagra and Cialis are not the same, even though they sound alike, right? Cialis is Tadalafil and Viagra is Sildenafil. So in order to decide which is the best option for you, first, I want you to think in terms of your erection goals. Ask yourself, do I want to take Viagra or Cialis because I'm just struggling to get stiff at all? Or do I want to take Viagra or Cialis because although I can get stiff, it's just not as predictable and I just need a little bit of help? Well, I always want you to get to the root cause and to find a cure for your erectile dysfunction. And typically, I advocate for natural and holistic health strategies. It's important to understand all available options, though, and to understand how to potentially do a hybrid version, right? Which could be a dab of medication with a mix of all natural. So today, we're going to discuss these two really well-known medications as part of an informed choice on your health journey, so to speak. So when you log into those online pharmacies or speak with your doctor in person, I want you to have a plan as to which of these PDE5 inhibitor medications should you choose for your version of erectile function. So let's face it, because your doctor could care less what you choose. Ideally, the best hypothetical outcome for erectile dysfunction is for you to take a medication for a while, only to look up after months of use and you're out of town and without the meds and bam, you just don't need them anymore. So first, let's talk about which to choose if you answered the above question that you want to take Viagra or Cialis because you can't get stiff on your own much at all. Because for you would lean towards taking a small dose of daily generic Cialis for 3 months and then taking a high dose of generic Viagra as needed for sex, if you can stand the side effects. Tadalafil or Cialis is the medication that has been shown to actually lead to improvement of erectile function over time. Not much, but some. In fact, clinically normal erectile function is defined by an International Index of Erectile Function domain score, and that would be a domain score over 26. So men were randomized to once daily treatment with Cialis 2.5 or 5 milligrams or placebo for 3 months. And they followed after those 3 months of 1 month taking a high dose version of like Viagra. And then they went without taking any drugs at all. And they did 2 identical, double-blind, randomized, placebo-controlled studies, and they concluded that the treatment with Cialis once daily actually improved erectile function in men with mild to moderate impairments, even after they stopped taking it. So, of course, I want you to take things to the next level. Now, if you're taking all of these meds, you'll not need to take a nitric oxide boosting supplement. I repeat, do not take the nitric oxide boosters if you're taking high doses of Viagra along with it, right? Because it can also cause your blood pressure to decrease so much that you'll end up dizzy and really unable to find the right place to put it in anyway. So instead, you would want to follow this medication protocol that you and your doctor set forth while following my pumping protocol and making sure that your daily E-function smoothie recipes to boost nitric oxide production naturally, that you're taking them. Because your goal after being on the meds for 4 months is you want to see measurable improvement, right? Improvement that you notice and your partner notices and that brings smiles. So after you stop that treatment protocol, you want to start on something that doesn't have L-arginine in it to support healthy nitric oxide levels. Now, I have some free gifts for you below that are actually pinned in the comment section so that you can learn more about the pumping protocol. You can learn more about how to use the smoothie recipes to support nitric oxide levels, because honestly, you don't want to be on an all medication regimen without putting some things in place that are designed to heal the issue over time, because I'm talking about these drugs right now, but I do not want you on them for the rest of your life. Now, every treatment option, especially pharmaceuticals, requires a balance of benefits and potential risks. So it's essential not only to think about effectiveness, but also to consider how your body tolerates these drugs and what side effects you can actually look forward to, if we could say that, right? And which ones are manageable and which ones are too disruptive. Now, Viagra, known by its generic name Sildenafil, I want you to think of the R&B group SWV. And Cialis, known as Tadalafil, think of it as a CT scan, are among the most recognized treatments for erectile dysfunction. And as PDE5 inhibitors, they work by enhancing blood flow to the penis, which is crucial for developing and maintaining an erection. The mechanism of action is that it works on the messenger molecule cyclic GMP to keep elevated levels of nitric oxide within the blood vessels in order to get those blood vessels to relax, stay wide open, and this causes blood flow to increase in certain areas of the body, particularly the erectile tissue. Side effects come into play because other tissues do it too. Viagra requires you to plan. You have to take it within an hour in order for it to be effective, and it needs to be on an empty stomach. On the other hand, Cialis offers you more flexibility. You can take it after a big meal if you haven't fallen asleep. It starts to work in about 30 minutes. Maximal effectiveness is about 2 hours. And Viagra is suitable for short-term use. Lasts about 4 to 6 hours. And while Cialis can stay in your system for up to 36 hours, providing you for kind of a longer window for heightened spontaneous activity. So now what if your answer to the question I asked above was that your purpose for taking either of these is that you want to take Viagra or Cialis because although you can get stiff, it's just not predictable and you just need a little bit of help. Then bam, you actually need a different strategy than the gent above. You don't need to take this every day. So deciding whether Viagra or Cialis is better for you isn't just about effectiveness and side effects. It also involves considering your overall lifestyle and your health. Now, while both drugs offer about the same quality of erection, in a study, slightly more men achieved a satisfactory erection with sildenafil. And clinically, I think most men feel as though Viagra works better, but men actually prefer to take Cialis because of less side effects. Now, Viagra appears to be more effective in a pinch. So if you are about to get some and you know your erection struggles sometimes, Viagra would be the way to go. But you have a small window of time to do it. And some guys will take too long to negotiate the exchange, fall asleep, and bam, it's morning, and it isn't in your system anymore, and it's not working. So there are plenty of stories of wasted Viagra. So if you schedule sex, Viagra works well for you. But if your lifestyle values spontaneity, Cialis might be the better choice due to its longer effective period. Now, a clinical trial that compared the outcome of Viagra to Cialis found that the starting dose of Viagra, 50 milligrams, had the greatest efficacy or effect on an erection, but also had the highest rate of overall adverse events and side effects. Cialis 10 milligrams had kind of intermediate effectiveness, but had the lowest overall rate of adverse events and side effects. So, measuring off of side effects, that's that. So let's discuss highlighting the side effects that your healthcare provider may not have told you about, whether it comes to Cialis or Viagra. Now, let's start with Viagra first because it's been around the longest. Some common side effects include headaches, hot flashes, reflux or indigestion, almost feeling like the food may get stuck right through here, nasal congestion, I call that the sex stuffy nose, or dizziness, changes in vision. You may develop a blue hue or a loss of vision. Loss of vision is potentially a severe side effect of Viagra, and in certain rare clinical situations, you should stop and get medical help immediately if this occurs, as it can lead to permanent blindness. Now, the eye risk is much greater with Viagra than it is with Cialis, and patients with certain eye problems, heart disease, high cholesterol, high blood pressure, type 2 diabetes, and smokers are actually at a higher risk of complications when taking any of these medications. Now, sildenafil is associated with increased rate of vision changes. So Viagra, more vision changes. Now, Cialis tends to have a higher incidence of muscle aches and back pain, and its duration in the body, it stays around longer, may prolong some of these effects. Now, like Viagra, Cialis can cause headaches, indigestion, and nasal congestion, stuffy nose. However, Tadalafil can cause unique symptoms like back pain, cough, upper respiratory infections, getting stuff stuck, right here when you're trying to swallow it. So keep in mind, it stays in the system longer. So it sticks around and can cause problems longer. Now, I have to tell you this, even after all of these side effects, recent published studies show that using these drugs may reduce the risk of early death from heart disease by up to 25%. Now, I think that this is a big pharma marketing thing, to be honest, because clinically, the men I have seen who use this stuff regularly, particularly Viagra, well, let's just say I haven't seen this at all. Quite the opposite. So neither Viagra or Cialis should be taken within 24 hours of taking prescription nitrates like nitroglycerin, isosorbide mononitrate, or isosorbide dinitrate. This can lead to kind of life-threatening low blood pressure. Viagra and Cialis should not be taken within 24 hours of taking alpha blockers, which you may be on for BPH like tamsulosin, doxazosin, etc., as this can actually lead to life-threatening low blood pressure too. So careful too if you're taking antibiotics like a Z-Pak or erythromycin, because these can increase the plasma or the blood concentration of Viagra and Cialis in your body, and even a small dose may function like a large one. So remember here that the goal is to find a solution that fits seamlessly into your life and works harmoniously with your body. Now, whether it's Viagra's short-term effectiveness or Cialis's extended capability, the best choice is really going to be the one that aligns with your personal needs, your health conditions, and what you can tolerate. So while medications like Viagra and Cialis are effective for so many people, integrating natural and holistic strategies can also offer a substantial benefit so that you may not need these prescriptions. So think about it in terms of regular lifestyle, moving more, engaging in physical activity can improve circulation, boost testosterone levels, and enhance erectile function. Bam! Just brisk walking, swimming, yoga. They're all excellent for our overall cardiovascular health, and they will make a change. Also, eating a diet that's rich in fruit, vegetables, and lean protein can improve heart health and reduce ED symptoms. Foods particularly beneficial for erectile function are leafy greens, nuts, seeds, all that are high in antioxidants and blood flow, which increases nutrient delivery. This is one more reason why you should make sure you get the free gift I've pinned below in the comments. It'll give you the power to unlock a surge of blood flow through your diet. Yes, eating for your erection. Who doesn't love to eat, right? Then, of course, chronic stress can impede erectile function. Practices like meditation, Tai Chi, deep breathing exercises, arm swingings even, reduce stress and improve mental health, which is essential for sexual health. And then, of course, ensuring that you get enough quality sleep is vital. Sleep deprivation lowers testosterone, and it will have a negative impact on your erection. So aim for about 6 to 9 hours a night. And these are just a few holistic options that you want to layer on top of any medication that you're taking, so that our goal is that you're not on these forever. So there are a ton of different strategies that you can use in the natural space to stay healthy and stay stiff. So I actually recommend watching one of my videos on doing that right here. Or is it here? Right on the screen, right? Now, here's the thing. Making the right choice between Viagra and Cialis really should involve a conversation with your healthcare provider. Now, decide what your sexual goals are. Look at your risk factors for adverse events. And for you, it may be trial and error, which one works best for you, or which one has a side effect profile that you can tolerate, because all of that matters. And of course, I think you have to combine any prescription medication with a holistic healing option. So you don't want to be dependent on this stuff for the rest of your life. You actually want to look up and be like, bam, without needing anything. So your physician can help you with the guidance of an overall profile of meds that you should be taking. So subscribe, turn your notifications on, and don't miss out on any of this groundbreaking men's sexual health information. I'm Dr. Rachel, and I'm out. I love you, and see ya. Boom.